for a couple hours, I think it is, and then we'll talk a little bit about oncology before we leave today. Then next week we'll finish up the oncology. So you're going to have to work with me here for a few hours this morning and next week. Then after that, I won't see you again until the end when we do a meeting. So you all know where you're at this point in level 3. I think you've had a couple of tests, right? When's your next test?
Next Friday.
Next Friday. So you'll be done with oncology, but you won't be tested on that, right?
Right.
But you will be tested on INTEGUMENT this time.
Yep.
Now it is one of the shorter topics that you have, because I was asking earlier, and y'all have GI and excretion plus INTEGUMENT. Okay. Like I told y'all before, told other classes before, what you got to think about is equal sacrifice when it comes to these topics. Just because one may be a few less questions than another one, you could fail a test if you neglect to study all 3 of them, right? So make sure that you give yourself an opportunity to study each one of your contents so that you do well on all of them. Now what I'd like to do today, because this is kind of a fun topic with the INTEGUMENT, you know, some topics are more fun than others, okay? So what I want to do is I'm going to kind of briefly go over our objectives like I normally do. And then I'm going to have you all help me out with this PowerPoint. I'm not a PowerPoint fan, y'all know that. But I do want you to see pictures, and you do have access to this on your modules. But in order to make sure we don't misunderstand something, picture paints 1,000 words sometimes, okay? So we'll be looking at some pictures on here as we go through these slides. All right, you have basically 2 chapters that deal with this INTEGUMENT. I would encourage you to go into your book and read about these disorders here, because you got to know about them in order to understand them and answer questions about them. Y'all, I have to read this stuff too. So I encourage you to read it, because that's where the questions come from, is the reading material, plus your objectives. You've got 2 concepts that we're going to deal with. One is tissue integrity, because we're talking about things that's on the skin, right? Okay. And we're going to talk about safety, because safety is the #1 priority in most everything, right? Because we have to keep our patients safe. Now, as far as what we're going to talk about, you all up to this point understand how the objectives work, right? You understand there's a similar pattern as it relates to how the objectives flow and what you're going to be charged with understanding and learning about the content. And the first one always talks about assessment. So we've got to look at assessment. We've got to look at skin assessment, okay? We're going to talk a little bit about pressure ulcers, okay? We're going to do a little bit of a review from things that y'all had from level 2. And pressure ulcers will be one of them. And so your objective talks about skin assessments, turning, repositioning, pressure relieving, support surfaces. So that all makes sense. Then the next one has to do with applying what you know about the anatomy and physiology of the skin. What's the layers of the skin? How are they involved in pressure ulcers? How are they involved in these skin cancers? Or how are they involved with herpes, or scabies, or lice? Okay? So we're talking integument here, skin. So you need to draw on your anatomy, physiology of the skin. Then we're going to look at some nutrition and how that relates to people with skin issues. The next one has to do with setting those priority actions. Y'all, up to this point, understand that you're going to be tested on priorities. You also understand that when you have a priority situation, what that means to you is that everything that's listed is correct. There's just one that you do first. One that's the most important to do first. It's a priority. So you're going to have questions that relate to that. The next one has to do with your medications. Now, we don't have a whole lot of different medications, but we do have some that relates to treating some of these skin disorders. And we'll talk about those as we progress through. The next one has to do with diagnostic tests. And what that means is maybe we need to do a culture to find out on this skin cancer what it is, or a biopsy. Okay? It mentions here smears, CBC, and a liver function test. The next objective has to do with these therapeutic devices that we use for pressure relieving things, like those different pads that we use, the beds that we use, you know, to relieve pressure on these pressure ulcers and prevent it getting worse. Talks about dressings that we may use on some of these wounds, and it also talks about taking pictures of them. And y'all understand why taking pictures is important as it relates to wounds, right? You understand that if a patient comes into the hospital and they have a wound already, we want documentation that they came in with that wound. That way they can't say you got it when you got here, okay? So that's important nowadays. The seventh objective has to do with applying infection control. Now y'all understand why that's important as it relates to the skin. So what's the most important thing that we can do to prevent infection? Hand washing. Okay? Now when it comes to taking care of people's wounds, we have to be as aseptic as we can when we're providing care to these folks. Because definitely we want to use standard precautions. Do y'all know what standard precautions are? Tell me what standard precautions are.
Precautions that you use for everybody, because you use the same everybody's behaviors.
Everybody gets standard precautions, right? But what you get based on your wound and somebody else gets based on their wound, can that be different? Okay. And let's take, for instance, an example of that, just because I want to explain the importance of this, is if you've got a patient who has HIV, okay? And they have body fluids that you have to touch, okay? Then you'd use gloves, right? Okay. Depending on where those fluids are, you might have to have gowns, right? And I don't think it was any of you all, possibly, I don't know. I had a group of students in level 2 that I took to clinical, and we had a patient who had just died with HIV/AIDS. And they had a lot of bleeding out of different orifices, okay? And they had an NG tube, blood coming out that NG tube, had a wound on their neck, blood coming out the neck, out the cavity, out of abdominal tube, everywhere else, okay? So, how y'all think we dressed out?
Fully gown, mask, everything.
Everything. Goggles, everything. Okay? Just simply because you think about it. If you're going to pull an NG tube that's got blood in it from a patient infected with HIV, when you pull that tube, you know, I've always taught, maybe not all of y'all, but as we do the NG tube, you know, I tell people to catch it in a towel or something so you don't splatter it everywhere, you know? But you still gotta protect from that. You remember that? No, you wasn't there. Not when we did that. I can't. Okay, but I just know that, you know, that's a situation where, yeah, you're gonna use standard precautions, but standard precautions may indicate other things that you use, right? Just keep that in your mind. And also, think about TB. If you've taken care of a patient with TB, you're gonna use standard precautions in addition to what other kind of precautions? Airborne precautions, okay? I just want to make sure y'all understand standard precautions and how that works, because it's whatever it takes, right? You're going to use standard precautions, meaning you need gloves. If you go into a patient's room, even if they have HIV, and you go in there and to talk to them, do you have to wear gloves to go talk to them?
No.
Do you have to wear gloves if you're going to just touch a hand?
No.
And if there's no open wounds, okay, if there's no open wounds or no issue there from skin integrity,
Then
you
you're
see what I'm
fine.
saying? Then you should be okay. And when we're talking about these conditions here today, and we're talking about things like, psoriasis. An example I think of when I'm thinking about this objective is that psoriasis causes a lot of flakiness, a lot of skin integrity issues, right?
Mm-hmm.
And it can be anywhere, right?
Mm-hmm.
And a lot of people have, they feel like nobody wants to touch them. But is that contagious?
No.
No, it's not. Now, if it was impetigo, that might be a different situation, right? But with the psoriasis, that's an issue that some of these folks have, is that nobody wants to touch them because they think they're going to get it. Okay? So that's why y'all got to be educated about these conditions and things. You know, you just don't want to go up there and be touching their sores now. I'm not saying that. I'm just saying that a lot of times they feel like people don't want to touch it. Okay? All right. And the next one has to do with just giving them good education. Teaching them about things. Teaching them about how to take care of themselves. And keeping our patients safe. That's what we're charged with. And the next one has to do with some of those ethical and legal things that, we kind of fall into right there with some of these conditions. And how we take care of folks based on their culture. Because there's always some cultural issues that we have to deal with sometimes. And we have to know about that and abide by those. All right, so that's our basic objectives. And y'all see how, as you move forward with your content, all this pattern of how these objectives are written, they're very similar, right? Y'all following me? Follow me? Okay. Now, the current topics for INTEGUMENT is, the first one is pathophysiology, abnormal cell proliferation disorders, such as, we're going to talk about some that are viral, some that are bacterial and fungal. And then we're going to talk about the skin cancers like the melanoma and the precursor to skin cancer, which is actinic keratosis, and then others, it says. So we're going to talk about whatever's up here, we're going to talk about. All right? And then we're going to talk about pharmacology a little bit. Topical antibacterials, antifungals, and antivirals. And then a topical chemotherapy. We'll talk about that. Now, see, it doesn't specify so much what these are. It just gives classifications. And y'all know up to this point that you need to know more about a class of drugs rather than a name of drug, right? So you understand what the drugs do versus all these different names that they're coming up with. Because you got books that'll help you with that, but you still kind of have to know what that class of drugs does. Then you have the diet objective. Talks about high calorie, high protein. Now, how many times have y'all been told that?
A bunch.
A bunch. And you're going to continue to hear that a lot, okay? And we're going to talk about it too, and how that helps our patients with skin integrity issues. And it moves on down to the nutrition, or the enteral nutrition, which is an advanced type of nutrition. And it says nutritional supplements. So it kind of goes into a lot of that. Why do y'all think it's important for us to realize nutrition? Why is that so important with skin issues? Healing. Okay? You've got to have good nutrition in order for people to heal well. Right? So they have to get it however they can. All right? So that's why these are all on here, is just to make us aware that we have to make sure that our patients are getting the nutrition they need to heal well. All right. So that's the objectives. Now what I'd like to do, and I know y'all not going to be real happy about it, but I got to be with y'all for 3 hours today, so I can't do all the talking after I talked yesterday for 4. Okay? But what I have is I've taken all of the slides that's on this PowerPoint, whoops, and I got a card. I want you to partner up with somebody. Okay? And I'm going to give you a couple of these slides. Find your partner. Okay? Which one y'all want?
Whatever you want to give us.
I'll give you two.
Okay.
I'll help you. You gonna do them?
I get just on my board where I have to do that on my fresh pack of soup.
Eric's on it today, ain't he? I said Eric's on it today, ain't he? What chapter was on to? 24.
Yeah, because there's 3 of them.
I know what
Always say that. Always.
Do what now? No, not yet. I will. In a minute. Where am I going? Of what? Oh, you're pulling it out.
Oh, did they actually have lots on it already? I just Googled it.
Yes, it's the slide. It's kind of go out there where it's sliding. There's slide 21 through 23.
Give me a minute. 45, 14. It's MC, capital A. A-R-T, or whatever you say, you spell it. Yeah. A part Moss Plant. Mississippi.
I thought you just lie and have a lot of quiet address, but it wasn't either.
That's my address. This is Eldon. 239 919 0905.
You don't have to pay to come.
This is cool. King Hunter.
All fees.
5.
Can you eat all those stuff with girls?
Bulldogs.
Dog.
Can't eat peppermints either.
For what?
That pops in my day. I was like, I'm looking at you too. No, it's been
I don't know. That's what I was fixing to look at.
Peppermints or?
Mm-hmm. Yes.
We didn't know the soft one together started doing with
Yeah.
highest priority cat. Why you want to?
I have Zoto, which is she has a covered figure.
All the way to the bottom.
All the way
I
down.
know. I didn't look.
2.75.
I have extras, I missed anybody.
Something else. That's not the one I want.
Do you have any?
Any what? What?
I love her playing, but I only have one.
All right, y'all take a few minutes and look up your little topic and then we'll start.
What are you yelling at? What are you yelling at?
She's the player's bitch.
Please don't forget it.
I wasn't a positive.
Why not? And what do you want us to do with these? I was just.
I just want you to be able to speak to them.
Oh, okay.
You know, when we go through them, just tell me what you think about them. That way everybody will at least have an opportunity to go over this PowerPoint with me. Okay? Because you never know what question you might have, and it might be your topic. You'll get that question right.
What the hell? So what you put for the awards and stuff? Just
I got the GI museum scholarship. Last semester, you know that veteran scholarship? The blue one? They paid a second one for the first time last semester. Meet Nikki, Aunt Rose, whatever. She got the shot blue one. And they created the GI one.
oh, okay.
So I got $500 scholarship. But
That's cool.
Who nigga gastro
Who are you talking about over there?
Nikki, Ann Rose, Nikki Rose.